So we'll be talking about the skeletal anatomy relevant to the genicular nerves. As the word genu means knee, these are the nerves supplying to the knee joint. And there are 6 groups of genicular nerves. The one on the medial side are called superomedial. Intermediate, the one on the lateral side are called as superolateral. The one that are inferior called inferomedial genicular nerves. And then you have 2 groups. One is the recurrent genicular and inferolateral genicular nerve group. Out of all these genicular nerve groups, the most commonly targeted are the 3: superomedial, superolateral, and inferomedial. To perform the genicular nerve group block, I would call it a nerve group block because these are not just one nerve, it's a group of nerves. To perform the injection, the ultrasound probe needs to be placed longitudinally, looking for the junction of the shaft and the condyle. And the soft tissue structure you'll be looking for would be the vastus medialis muscle and the blood vessel, which is the superomedial geniculate artery. The needling, you can perform an out of plane technique needling, touching the bone and injecting 2 cc of local anesthetic for the diagnostic block, or you could perform in plane technique injection where the needle can be brought in plane from superior to inferior and just placing the needle next to the artery and injecting 2 cc of local anesthetic. Similar way you would perform the superolateral genicular nerve group block, where you will be looking for the shaft and the condyle junction and the artery and bringing the needle either out of plane or going in plane. In terms of the inferomedial genicular nerve, the most important structure to look for, you start looking at the intra-articular area and moving the probe down, looking for the tibial condyle and the shaft junction. And here you will find the medial collateral ligament as a structure which is of importance because your needle needs to be below the medial collateral ligament in order to get these nerves. So I'm going to talk to you about the knee genicular nerve group block. There are 6 groups of genicular nerves. These are groups of nerves, so that's why we call them as superomedial genicular nerve group, intermediate genicular nerve group, superolateral genicular nerve group, inferomedial genicular nerve group, inferolateral and recurrent genicular nerve group. Out of these, most commonly targeted are superomedial, superolateral, and inferomedial. To scan these nerves or the nerve groups, you always would use high frequency linear ultrasound probe on an average size patient. If the patients have a high BMI, you may have to use a curvilinear probe. The starting point will be the knee joint, and here we have a knee joint along with the medial meniscus that's visible and the medial collateral ligament that's been shown on the image here. Once we see this, we will be moving up looking for the femoral condyle and moving up, and you will start to see a lens-shaped muscle coming into the view, and this is your vastus medialis muscle. Once you see the vastus medialis muscle, you will be looking for arterial pulsations of the superomedial geniculate artery, and you could see the pulsations here, and you could bring the needle out of plane or you can bring the needle in plane from proximal to the distal or out of plane and inject 2 mL of local anesthetic, and this will be your superomedial genicular nerve group block. Moving on to the inferomedial genicular nerve group, starting point will be looking at the knee joint and then moving the probe down looking for the tibial condyle and the tibial shaft, and you have a small blood vessel that's pulsating here. That's your inferomedial geniculate artery. I'm going to reduce the depth, which will make the image more clear. And you see the thick band, which is the medial collateral ligament. The reason this ligament is important, your needle needs to be below the medial collateral ligament. You can do an out on plane technique or you can do a in plane technique coming from distal to proximal. Moving on to the lateral superolateral genicular nerve group, the starting point will still stay the same. This is the knee joint. You're looking for on the lateral aspect the tibial condyle, the femoral condyle, the lateral collateral ligament, and now we are moving up and we are looking for the muscle which is the vastus lateralis muscle, and you would see the junction of the condyle and the shaft, and there is a pulsation of the superolateral geniculate artery. And here you go, we have lots of vessels here. I put the color Doppler, and that will, the power Doppler will show you a lot of blood vessels, and your target is at the junction just next to the superolateral geniculate artery. You can bring the needle out of plane or you can bring the needle in plane. Just make sure you avoid the artery and don't inject in the artery. Just park the needle next to the artery, and that's the superolateral genicular nerve group. To perform the intermediate group, you'll be placing your probe on the top of the patella, locating the quadricep muscle, and we will be increasing the depth here. And here we have quadricep tendon, and it will be below the quadricep tendon on the top of the femur is where you will catch the intermediate genicular nerve group. We can perform an in-plane technique. I won't recommend doing out of plane for this procedure, given that you have a quadricep tendon. It can be very painful for the patient. You can do an in-plane technique coming from lateral to medial and putting 2 mL of local anesthetic for the intermediate group of genicular nerves.